Dr. Persia with Tier 1 Physical Therapy. So after I got off the phone with my mother last night and listened to her complaints of back pain that turned to buttock pain that led down her leg into the calf pain that only worsened with standing and walking and got way better with sitting, it sounded very much like spinal stenosis to me. So after answering all those questions, I realized that a lot of other people probably have the same questions. So I want to make this quick video about lumbar spinal stenosis. So the word stenosis itself just means a narrowing of. So it's actually pretty common to have a little stenosis here and there in your back. So if we turn the spine around, it can happen pretty commonly in the cervical spine, the neck, rarely in the thoracic spine, but definitely possible, and the lumbar spine. So usually it is the lumbar spine, and even more specifically, it's the lower lumbar spine, like L4, L5, and then L5 on what they call S1, which is the sacrum. So if I bring this model closer to you, you can see how the roof of one vertebrae and the floor of the one below it form a hole. That hole is called the foraminal space. So that's where the nerve, the peripheral nerve off of the spinal cord, is located. If there's encroachment, closure, loss of space, anything that would encroach the space of the nerve, it would get pinched and create some form of pain wherever this nerve has its distribution. So anytime there's compression, that nerve will send signals to the area that's innervated by this nerve. So things like standing, things like walking, things like being upright for too long tend to put more pressure on the spine. And extension, which is this position, closing down the vertebrae. Things that cause flexion or bending, sitting, reaching down to tie your shoes, seem to make the symptoms go away. And that's typically what you want to do. Even though spinal stenosis cannot be cured entirely without surgery, you can manage the symptoms quite well and be relatively pain-free and do all the things you love to do. You just have to watch your positioning. So your position is everything. So just to recap, stenosis is a narrowing of, so spinal stenosis is a narrowing of spinal space where the nerves exit. Each nerve innervates a different part of your body. So it's very common to get it around the shin, the outer shin, the thigh, usually the back, but it can be the front, the buttock, and even across the lower back. So depending on what level you have spinal stenosis, depends on what level you're going to feel the pain. So it's a very common situation that happens, but there's some really good things you can do to make it better. So after watching this video, if you feel like these symptoms are very familiar to you, that walking and standing both bring on your leg pain, yet sitting take them away pretty quickly, and you'd like to know a little bit more about it, or maybe what exercises you can add into your daily activity to help you get rid of it, please feel free to contact us. We'd be more than happy to help you out. Just check us out at tier1dpt.com and fill out any of our contact forms. Thank you so much and have a great day.